Good afternoon. This is All India Radio. I'm Anubha Rohatgi, and with me is Abhishek Mukhopadhyay with the Midday News. The headlines. Prime Minister Narendra Modi says he dreams of setting up one medical college in every state to impart education in regional language. Launches a Assam Mala program to boost the connectivity, road infrastructure and economic progress in the state. Prime Minister to dedicate key oil, gas and road infrastructure projects at Haldia in West Bengal. President Ramnath Kovind says country is proud of our doctors and paramedics who risked their lives and rose to the challenge of COVID-19. Over 57 lakh people administered COVID-19 vaccination so far in the country. Information and Broadcasting Minister Prakash Javadekar flags off Corona Vaccination Awareness Campaign in Pune. In Uttarakhand, massive flood hits Chamoli district following an avalanche. ITBP team rushed for rescue operation, Union Home Ministry monitoring situation. And in cricket, India were 131 for 4 against England as the visitors amassed 578 runs in first innings of the first test in Chennai. As the nation fights the COVID-19 pandemic, we begin with a message of precaution to stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki doori for social distancing, focus on hand and face hygiene. And now, the news. Prime Minister Narendra Modi today said he dreams of setting up at least one medical college in each state in the country where the medium of instruction is a regional language. The Prime Minister was speaking after launching the Assam Mala program in Dhekiyajuli of Sonitpur district in Assam with an aim to boost the state's road infrastructure and contribute to the state's economic progress and improve connectivity.
आजाद भारत जब 75 में प्रवेश कर रहा है तो मेरा एक सपना है हर राज्य में कम से कम एक मेडिकल कॉलेज, कम से कम एक टेक्निकल कॉलेज वो मातृभाषा में पढ़ाना शुरू करें। चुनाव के बाद जब नई सरकार बनेगी असम में, मैं यहां असम के लोगों की तरफ से आपको वादा करता हूं कि असम में भी एक मेडिकल कॉलेज स्थानीय भाषा में हम शुरू करेंगे, एक टेक्निकल कॉलेज स्थानीय भाषा में शुरू करेंगे और धीरे धीरे ये बढ़ेगा। ये डॉक्टर असम के अलग अलग क्षेत्रों में, दूर दराज इलाकों में अपनी सेवाएं देंगे। इससे भी इलाज में सुविधा होगी, लोगों को इलाज के लिए बहुत दूर नहीं जाना होगा।
The Prime Minister said that 2 medical colleges will be set up in the state to enhance healthcare facilities in Assam.
आज उत्तरी असम और अपर असम की जरूरतों को देखते हुए विश्वनाथ और चरईदेव में 2 और मेडिकल कॉलेजों का शिलान्यास हो गया है। ये मेडिकल कॉलेज अपने आप में आधुनिक स्वास्थ्य सेवाओं के केंद्र तो बनेंगे ही, साथ ही अगले कुछ सालों में यहां से ही मेरे हजारों नौजवान डॉक्टर बनकर के निकलेंगे।
Speaking about the recent development projects undertaken in the state of Assam, Prime Minister said the Northeast is moving ahead on the road of development and Assam is playing a significant role in it.
हम सब हमेशा से सुनते आए हैं, देखते आए हैं कि देश की पहली सुबह पूर्वोत्तर से होती है, लेकिन सच्चाई ये भी है कि पूर्वोत्तर और असम में विकास की सुबह को एक लंबा इंतजार करना पड़ा है। हिंसा, अभाव, तनाव, भेदभाव, पक्षपात, संघर्ष, इन सारी बातों को पीछे छोड़कर अब पूरा नॉर्थ ईस्ट विकास की राह पर आगे बढ़ रहा है और असम इसमें प्रमुख भूमिका निभा रहा है। ऐतिहासिक बोडो समझौते के बाद हाल ही में बोडोलैंड टेरिटोरियल काउंसिल के चुनावों ने यहां विकास और विश्वास का नया अध्याय लिख दिया है।
The Prime Minister said from independence to 2016, Assam had only 6 medical colleges, but in the last 5 years, Assam has built 6 more medical colleges.
मुझे असम के लोगों ने बताया है कि उन्हें हमेशा यही चिंता रहती थी कि कोई मेडिकल इमरजेंसी न आ जाए, लेकिन ये समस्याएं अब तेजी से समाधान की ओर आगे बढ़ रही है। आजादी के बाद से 7 दशकों में यानी 2016 तक असम में केवल 6 मेडिकल कॉलेज होते थे, लेकिन इन 5 सालों में ही असम में 6 और मेडिकल कॉलेज बनाने का काम शुरू किया जा चुका है.
Mr. Modi said Assam's freedom fighters had given their lives in 1942 for the respect of the Indian tricolor and its independence in this region. Today, India's brave hearts are waking up and drawing inspiration from the freedom fighters and their sacrifices.
1942 में इसी धरती पर असम के स्वाधीनता सेनानियों ने देश की आजादी के लिए, तिरंगे के सम्मान के लिए अपना बलिदान दिया था. इन शहीदों के खून की एक एक बूंद, उनका साहस हमारे संकल्पों को मजबूत करता है. इसलिए शहीदों के शौर्य की साक्षी सोनितपुर की ये धरती, असम का ये अतीत बार बार मेरे मन को असमिया गौरव से भर रहे हैं.
The Prime Minister warned those who were hatching a conspiracy to defame the tea sector of the country and said that the country wouldn't spare anyone who is doing it.
मैं असम की धरती से इन षड्यंत्रकारियों से कहना चाहता हूं, ये जितने मर्जी षड्यंत्र कर ले, देश इनके नापाक मंसूबों को कामयाब नहीं होने देगा. मेरा टी वर्कर इस लड़ाई को जीत के रहेगा. भारत की चाय पर किए जा रहे इन हमलों में इतनी ताकत नहीं है कि वो हमारे टी गार्डन वर्कर्स के परिश्रम का मुकाबला कर सके. देश इसी तरह विकास और प्रगति के रास्ते पर बढ़ता रहेगा. असम इसी तरह विकास की नई नई ऊंचाइयों को छूता रहेगा.
Mr. Modi said that 1,000 crore rupees have been announced in the union budget for the development of the tea workers. He said that the setting up of new medical colleges in Assam would provide 1,600 MBBS doctors every year. He said that once the AIIMS will be operationalized in Assam, it would change the life of Northeast. The Prime Minister said that Guwahati would become the hub of modern healthcare facilities.
आज गुवाहाटी में एम्स का काम भी तेजी से आगे बढ़ रहा है. इसका काम अगले 1.5-2 सालों में पूरा भी हो जाएगा. एम्स के वर्तमान कैंपस में इसी एकेडमिक सत्र से एमबीबीएस का पहला बैच शुरू भी हो गया है. जैसे ही अगले कुछ सालों में इसका नया कैंपस तैयार होगा, आप देखेंगे गुवाहाटी आधुनिक स्वास्थ्य सेवाओं के केंद्र के तौर पर उभर करके सामने आएगा. एम्स गुवाहाटी केवल असम ही नहीं बल्कि पूरे पूर्वोत्तर के जीवन में एक बड़ा परिवर्तन करने वाला है.
Mr. Modi said that the world has appreciated the role of India in COVID management as well as in vaccine process. The Prime Minister said that infrastructure played a great role in improving the condition of Assam. He hoped that the Ahom Mala would further boost the infrastructure of the state. Mr. Modi said that much emphasis has been given in infrastructure in the union budget.
कोरोना से सबक लेते हुए देश ने हर देशवासी के जीवन को सुरक्षित और आसान बनाने के लिए और तेजी से काम करना शुरू कर दिया है. इसकी झलक आपने इस बार के बजट में भी देखी है. बजट में इस बार स्वास्थ्य पर होने वाले खर्च में अभूतपूर्व बढ़ोतरी की गई है. सरकार ने ये भी तय किया है कि अब देश के 600 से ज्यादा जिलों में इंटीग्रेटेड लैब्स बनाई जाएगी. इसका बहुत बड़ा फायदा छोटे कस्बों और गांवों के लोगों को होगा जिन्हें मेडिकल टेस्ट के लिए दूर जाना पड़ता है.
He said that the love of the Assamese people is very deep and keeps bringing him back to Assam. The way they have decorated Dhekia Juli was very beautiful and he would like to pay his gratitude for the efforts of the people. PM Modi also laid the foundation stones of medical colleges and hospitals in Vishwanath and Chariadio at the cost of over 1,100 crore rupees with an aim to boost Assam's health infrastructure. Each hospital will have a 500-bed capacity and 100 MBBS seat capacity. Earlier, Mr. Modi tweeted that he was glad to see immense enthusiasm in Assam and was happy to be getting yet another opportunity to be in the state. He assured that he will continue working for Assam's all-round development. On this occasion, Assam Chief Minister Sarbanand Sonowal said that Prime Minister Narendra Modi extended all support to fulfill the promises made by the party in 2016 in Assam. He said that the Prime Minister has taken utmost care for the development of Assam.
आपने असम को अलग अलग प्रांतों पर, अलग अलग सेक्टरों पर विकसित करने के लिए जो कदम पिछले 6 साल के अंदर लिया है, इसके वजह से आज असम में शांति व्यवस्था संभव हुआ है और विकास के रास्ते पर असम जोर से चलने लगा है। आपने देश के अंदर ईमानदारी से कैसे सत्ता को संभाला जाता है, इसका आपने उदाहरण खड़ा किया।
Mr. Sonowal mentioned that budget allocation has been made for the welfare of tea workers of the state as well as for the development of Majoli and Kamakha temple. He said that due to the efforts of Prime Minister and Home Minister Amit Shah, the BTR Accord was signed. In West Bengal, the Prime Minister will dedicate to the nation and lay the foundation stone of key infrastructure projects in the oil, gas and road sector at Holdia or Purba in Mednipur district. A Kolkata correspondent reports that it is his second visit to the state within 3 weeks.
On his second visit to the state of West Bengal within 3 weeks, Prime Minister Narendra Modi will dedicate to the nation projects worth rupees 4,700 crores at Holdia. He will lay the foundation stone of the second catalytic dewaxing unit at the Holdia refinery of Indian Oil Corporation Limited. He will also inaugurate 3 more projects. Bharat Petroleum Corporation Limited, BPCL's LPG import terminal, GAIL's Dobi Durgapur natural gas pipeline and NHAI's 4-lane ROB cum flyover at Rani Chowk. A road over bridge cum flyover built at Rani Chowk by NHAI with rupees 190 crores for seamless traffic movement in Holdia Port Gate will also be inaugurated. Madhuparna Dhar Chaudhuri, AIR News, Kolkata.
Centre in its union budget for the next fiscal has proposed to provide 1,000 crore rupees for the welfare of tea workers of Assam and West Bengal. The amount will be spent especially for the welfare of women and children associated with tea gardens in these states.
I propose to provide 1,000 crores for the welfare of tea workers, especially women and children in Assam and West Bengal. A special scheme will be devised for the same.
Our correspondent reports that people of Assam, which has over 35% of its population directly associated with the tea gardens, has welcomed the centre's outreach. Here is the report.
The lives of over 12 lakh tea workers in tea states of Assam and West Bengal is set to improve with Union Finance Minister Nirmala Sitharaman's announcement of a special package of 1,000 crore rupees. Indian Tea Association has said that the amount will be spent to ensure more comprehensive coverage on welfare schemes related to housing, education, sanitation and medical facilities, among others. In addition to the special package, the budget also has outlays for additional funding for development of social and physical infrastructure in the states of Assam and West Bengal. The allocation of 3,400 crore rupees for road infrastructure development in Assam and 25,000 crore rupees in West Bengal will speed up development of roads and infrastructure. This will resolve the bottleneck in terms of transportation from the tea gardens, which are generally located in the remote parts of the states. Additionally, the Pradhan Mantri Atmanirbhar Swasthya Bharat Yojana, which will operate in addition to the existing National Health Mission with an allocation of 64,180 crore rupees, will be used to develop capacities of primary, secondary and tertiary healthcare systems as well as upscale the existing facilities in these states. Anand Chaturvedi, AIR News, Delhi.
Finance Minister Nirmala Sitharaman today said that the government trusts the taxpayers and hence is working as a facilitator. Addressing industrialists on the Union Budget 2021 in Mumbai, Ms. Sitharaman said that she values every taxpayer's rupee, adding that each single penny should be spent qualitatively so that more wealth is generated. She said that Prime Minister Narendra Modi was clear in his thoughts of not putting any additional burden on common man through COVID cess. Disapproving the speculative media reports about COVID cess, she said they were mere false reports. The finance minister said even there are some developed economies which are struggling. However, India has found a way to survive. She credited the citizens of the country for it. She further said that since last 60 years, India was living with a socialist baggage. Because of the regulations and license Raj, Indian entrepreneurs could not show their complete strength. The Indian industries and entrepreneurs somehow survived the license quota Raj, she added. The finance minister said the steps which should have naturally followed after liberalization in 1991 did not happen. President Ramnath Kovind has said that the country is proud of our doctors and paramedics who rose to the challenge during the COVID-19 pandemic, even if it meant a great risk to their own lives. The President was addressing the annual convocation of Rajiv Gandhi University of Health Sciences at Bengaluru in Karnataka today.
COVID-19 has inflicted agony and misery of unprecedented levels around the globe. We are proud of our doctors and paramedics who rose to the challenge, even if it meant a great risk to their own lives. Truly, India's measured response to the pandemic has saved countless lives. I am glad to learn that this university trained over 2 lakh healthcare professionals, from doctors and nurses to administrators and hospital facility providers, to better respond to the outbreak. This campaign, I am sure, contributed immensely in creating a uniform response to provide quality care to COVID-19 patients.
Lauding scientists' efforts, the President said they achieved a rare feat to outsmart the challenge of the pandemic.
Health scientists like you have gained the upper hand in the novel coronavirus. Several vaccines have been produced in record time. Responding to the call of Atmanirbhar Bharat, that is a self-reliant India, our nation has not only manufactured the vaccine, but has also reached out to other nations to provide the same. The largest vaccination drive in history is underway in India.
The President said the pandemic has taught the world that one cannot be safe if others are at risk. It is a lesson in universal brotherhood, he said.
Though COVID-19 seems to be one of a kind health crisis that happens rarely, a section of scientists has warned us to be prepared for similar challenges ahead. The world has, let us hope, learned the right lessons. In the post-COVID phase, the world will have to pay more attention to public health care. While the priority there has to be the needs of underprivileged, we have seen a crisis that cut across class and geography. But the pandemic has taught the world that one cannot be safe if others are at risk. It is a lesson in universal brotherhood.
Mr. Kovind said healthcare delivery in the country is poised to undergo a change at all stages.
Healthcare delivery in India is poised to undergo a change at all stages: prevention, diagnosis and treatment. No single entity in the healthcare sector can deliver results and achieve outcomes. The evolution of the sector calls for active involvement and participation of all stakeholders and the use of innovation to bridge intent and execution. Moreover, the first major pandemic in over a century has taught us to be better prepared for unforeseen public health crises.
President Ramnath Kovind graced the function as the chief guest and Governor of Karnataka Vajubhai Vala, Chief Minister B.S. Yediyurappa, State Medical Education Minister Dr. K. Sudhakar were also present on the occasion. Renowned neurosurgeon Dr. Alangar Satyaranjan Das Hegde was conferred the Doctor of Science honour during the function.
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi says he dreams of setting up one medical college in every state to impart education in regional language, launches Ahom Mala program to boost the connectivity, road infrastructure and economic progress in the state. Prime Minister to dedicate key oil, gas and road infrastructure projects at Holdia in West Bengal. President Ramnath Kovind says country is proud of our doctors and paramedics who risked their lives and rose to the challenge of COVID-19. Over 57 lakh people administered COVID-19 vaccination so far in the country. Information and Broadcasting Minister Prakash Javadekar flags off Corona Vaccination Awareness Campaign in Pune. In Uttarakhand, massive floods hits Chamoli district following an avalanche. ITBP team rushed to for rescue operation. Union Home Ministry monitoring the situation. And in cricket, India were 131 for 4 at tea as England amasses 578 runs in the first innings of the first test in Chennai. For quick news updates around the clock, follow us on Twitter handle at AIR News Alerts. More than 57,75,000 frontline health workers have been administered COVID-19 vaccine in the country so far. The Health and Family Welfare Minister has informed that a total number of 3,58,473 people have been inoculated in the last 24 hours. Meanwhile, the country's COVID-19 recovery rate improved to 97.19%, with the recovery of more than 12,805 patients in the last 24 hours. The ministry said more than 1 crore 5 lakh patients have already recovered from this disease. There are only 1,48,766 active cases in the country, which comprises only 1.37% of the total positive cases. A total number of 12,059 new cases have been reported in the country in the past 24 hours, taking the cumulative positive cases to over 1 crore 8 lakh. The Health Ministry said 78 deaths have been reported within 24 hours, taking the toll to over 1,54,000 across the country.
Information and Broadcasting Minister Prakash Javadekar today flagged off Corona Vaccination Awareness Campaign of Regional Outreach Bureau, Pune. Speaking on the occasion, he said that India is the first country to cross 50 lakh vaccinations and planning is on to vaccinate the entire population. Mr. Javadekar said that this awareness campaign is being organized to clear all misunderstandings regarding corona vaccines. During the awareness campaign, 16 vans equipped with modern communication tools supported by folk artists will travel across Maharashtra and Goa. India has become the third topmost country in the world in terms of the number of COVID-19 vaccine doses administered. Only the United States and the United Kingdom remain ahead of India. The Health and Family Welfare Ministry today said 12 states in India have vaccinated more than 2 lakh beneficiaries each. Uttar Pradesh alone accounts for 6,73,542 of all vaccinated beneficiaries.
Bihar topped the country with 76.6% COVID-19 vaccination, according to data released by Union Health and Family Welfare Department. Madhya Pradesh is in second position with 76.1%, while Tripura is in third position with 76%. 3,69,979 healthcare workers have been vaccinated so far in the first phase of vaccination in Bihar. 8,507 frontline workers were vaccinated during the past 24 hours in the second phase, which started yesterday. No side effect has been reported from any part of the state. Meanwhile, COVID-19 recovery rate has improved to 99.08% in Bihar. 2,58,841 patients have so far recovered from the COVID-19 infection in the state. The number of active cases of COVID-19 is continuously declining. Currently, only 889 are receiving treatment at various hospitals. No positive case was reported from 16 districts of the state. The COVID-19 vaccination drive launched on January 16th has gained momentum in the Union Territory of Puducherry. The vaccination report of the Health Department revealed that 3,601 persons were vaccinated so far in the UT. More from a Puducherry correspondent.
The total count includes 3,557 healthcare workers and 44 frontline workers. The Health Director Dr. Mohan Kumar said that the vaccines are administered in 10 centers in the whole Union Territory on every Monday, Tuesday, Wednesday and Friday from 9 a.m. to 5 p.m. So far, no adverse complaints received by the department, and so people should come forward to take the vaccines without any fear when their turn comes. As far as the positive cases are concerned, today, Puducherry logged 22 new cases of COVID-19 detected while doing 2,029 number of tests. In the last 24 hours, no case of death was reported from any region. 27 persons were cured and discharged. The recovery rate in the Union Territory stands at 97.54%. Chandramohan, Air News, Puducherry.
In Uttarakhand, a massive flood has been reported from Chamoli district, where the water level in Dhauli Ganga river rose suddenly following an avalanche near Rishi Ganga power project at Raini village in Tapovan area of the district. The flooding due to avalanche has destroyed houses situated at the riverbank side. Several people working at Rishi Ganga hydroelectric power project were reported missing soon after the incident. According to reports, a dam of the Tapovan power project was breached and was feared washed away. NDRF DG SN Pradhan said teams of ITBP and SDRF personnel have rushed to the affected areas to rescue the villagers and locals.
The glacial outburst has already happened, so now the danger is from the water overflow and the flow which is going downstream. So we have to take care of that. So evacuation process has also started with the help of the local administration and local SDRF. The NDRF teams are going to reach by late afternoon, and they will be also joining the whole operation. I believe that the water is moving downstream, so it is going to move because of the gradient. It will move very fast. So we'll have to evacuation and other sort of help will be required. ITBP is also present in the Joshimath and all the downstream areas, and Army will also be present. So it will be a coordinated operation. 3 to 4 more teams of NDRF are being airlifted emergency basis. So overall, by late afternoon, I think all the agencies will be on the job, and hopefully we'll be able to save maximum life and property.
Meanwhile, rivers in the region witnessed flash floods soon after the glacier broke. Though the impact of the disaster may not be felt in Rishikesh and Haridwar, the towns have been put on alert. Chief Minister Trivendra Singh Rawat is rushing to Joshimath in view of the disaster. Prime Minister Narendra Modi today reviewed the situation in Uttarakhand. He spoke to Chief Minister Trivendra Singh Rawat and other top officials. Prime Minister's office said in a tweet that Mr. Modi took stock of the rescue and relief work underway. Authorities are working to provide all possible support to the affected. The Home Ministry is closely monitoring the situation. Home Minister Amit Shah said that he spoke to the Uttarakhand Chief Minister as well as DG ITBP and DG NDRF. He said all the concerned officers are working on a war footing to ensure security of all people, and NDRF teams have left for rescue operations. He said some more NDRF teams are being airlifted to Uttarakhand from Delhi. Mr. Shah ensured that every possible help will be provided to the Devabhoomi.
जोशीमठ के आसपास बहुत बड़ी दुर्घटना हुई है। ग्लेशियर टूटने के कारण, पहाड़ नदी में गिरने के कारण पानी का बहाव बहुत बड़ा है। पहले रूसीगंगा और बाद में अलकनंदा, वहां पर जलस्तर बढ़ने की शुरुआत हुई है। कुछ लोगों के हताहत होने की भी प्राथमिक सूचना हमें मिली है। एनडीआरएफ की 3 टीमें वहां पहुंच गई है। बाकी की टीमें दिल्ली से फ्लाई करके उत्तराखंड की ओर जाने के लिए तैयार है। कुछ ही समय में वो पहुंचेंगे। आईटीबीपी के जवान भी वहां पर पहुंच गए हैं। पूरे राज्य का तंत्र भी वहां पर एक्टिव हो गया। एसडीआरएफ की टीमें भी पहुंची हैं। मेरी मुख्यमंत्री जी से बात हुई, वो भी ऑन वे हैं, और वायुसेना को भी अलर्ट कर बचाव कार्य में लगाने के लिए हमने पूरी तैयारी कर ली है। मैं उत्तराखंड की सभी निवासियों को आश्वस्त करना चाहता हूं कि नरेंद्र मोदी सरकार इस संकट की घड़ी में उत्तराखंड के साथ खड़ी है और हर संभव मदद देकर इस संकट से जल्दी उत्तराखंड बाहर आए और आम जनजीवन पहले की तरह शुरू हो जाए। इस दिशा में हमारे प्रयास हैं।
The News Services Division of All India Radio in its bilingual live phone-in program tonight will bring you a special discussion program on COVID-19. Dr. Omkar Singh, Director, Health Services, Andaman and Nicobar Administration, Port Blair, will participate in the discussion. Listeners can ask questions to the expert on toll-free telephone number 1-800-11-5767. You can also ask questions on telephone number 011-2331-4444 and post queries on a Twitter handle at AIR News Alerts by hashtag AskAIR.
In cricket, India were 154 for 4 a while ago against England on the third day of the first test at M.A. Chidambaram Stadium in Chennai today. Cheteshwar Pujara and Rishabh Pant were at the crease with 53 runs each. And now let us take a look at the weather forecast for the day. In the national capital, shallow fog is forecasted. The minimum temperature was 8 degrees Celsius and maximum will be around 23 degrees. Mumbai will have mainly clear sky. The minimum temperature was 16 degrees Celsius and maximum will be 30 degrees. Chennai will have fog or mist in the morning and partly cloudy sky later. Kolkata is likely to have generally cloudy sky with light rain. And before we close, a look at the headlines again. Prime Minister Narendra Modi says he dreams of setting up one medical college in every state to impart education in regional language, launches a Home Mala program to boost connectivity, road infrastructure and economic progress in the country. Prime Minister to dedicate oil, gas and road infrastructure projects at Haldia in West Bengal. President Ramnath Kovind says country is proud of our doctors and paramedics who risked their lives and rose to the challenge of COVID-19. Over 57 lakh people administered COVID-19 vaccination so far in the country. Information and Broadcasting Minister Prakash Javadekar flags off Corona vaccination awareness campaign in Pune. In Uttarakhand, massive flood hits Chamoli district following an avalanche. ITBP team rushed for rescue operation. Union Home Ministry monitoring situation. And in cricket, India were 154 for 4 against England as the visitors amassed 578 runs in first innings of first test in Chennai. For details of these stories and more, log on to our website www.newsonair.com and News on Air app. And with that, we end the Midday News.